Have you ever heard of TMS not working?
Sure, there are some people, who diligently, come in, they get the treatments, it's in the right spot, it's in the right kind of stimulation, and it just doesn't work for them. That does happen, as is the case with medications, as is the case with therapy, as is the case with electroconvulsive therapy too, with ECT. There are some people who it just does not move the needle for them.
Are there any common factors around that surround that question?
So a great question, because if we could pick out who is not likely to be a responder, we might say, let's not try that. That's the case for any treatment. There isn't right now an established biomarker that we could use to say, oh, if the test result says this, you shouldn't do treatment A or B. What there is are from the very early studies with TMS, there were some predictor models that were looked at, and it seemed that the people who did not do well with TMS, and this is again the sort of the original classic TMS of once a day, the people who did not do well with that were people who had tried lots and lots and lots of medications. So the more treatments that had failed you, the more likely you were to have a hard time responding to TMS, which some people euphemistically say, so depression that's hard to treat is hard to treat.
Yeah.
And sadly, that is kind of the conclusion that we have. That said, there are people who have tried lots of medications, some people who have tried electroconvulsive therapy and have not been able to benefit from those things, and yet TMS will work for them.
I do hear that one a lot, actually. It's kind of surprising to me. Do you know why that is?
I wish I had a good explanation. It seems even that much like with the SSRI medications, the fluoxetines and sertralines and all those, if a person hasn't done well with the first trial, they have something like a 60-70% likelihood of doing well with another SSRI, which means, of course, that another 30-40% won't. And this is old literature that comes out mostly out of Mass General from many years ago. Likewise with the big STAR-D trial, there were people who didn't respond to an SSRI for the first round who did well with a different SSRI for the second round. And so why people respond to one thing or not and not to another, that was a big focus of my research when I was full-time at UCLA. And we have lots of questions and lots of ideas. We still don't have a practical biomarker to help guide treatment.
YouTube, do yourself a favor. Check out this next video right here.
That's the one to look for.